This month, I have discussed traumatic brain injury among victims of domestic violence and brain injury in the homeless population. This silent epidemic also needs to be discussed in our prison population, where according to the CDC, studies report anywhere between 25 to 80% of inmates having experienced a head injury or TBI. The CDC also reports female inmates who have been convicted of a violent crime are more likely to have sustained a pre-crime TBI or some other form of physical abuse. And children and teenagers convicted of a crime are also more likely to have sustained a pre-crime TBI or some other form of physical abuse. Traumatic brain injury may be both a cause and effect of being incarcerated. Besides brain injuries sustained before incarceration, prisoners may become victims of traumatic brain injury while incarcerated due to assaults and other causes. These studies lead to the inescapable conclusion that all prisoners need to be screened for traumatic brain injury. Why is this important? Because prisons present many challenges for individuals with a brain injury, which may further complicate their period of incarceration. These challenges include difficulties understanding and following directions, appearing to be slow or non-responsive to staff requests, impaired memory, which affects all aspects of confinement, impulsive behavior, and difficulty controlling anger towards other prisoners and staff, severe depression and anxiety, suicidal thoughts, as well as sensitivity to bright light and loud noises. If these issues are not addressed during the period of incarceration, then discharge may be more difficult with increased likelihood of a return to prison. Prison staff must be educated to these deficits and symptoms of a traumatic brain injury so that these individuals can be dealt with appropriately. This often means slowly repeating instructions, understanding why certain antisocial behavior takes place, and why rehabilitation rather than punishment is a more appropriate way of addressing these issues or problems. And community re-entry programs and re-entry staff should be trained to identify a history of traumatic brain injury and have access to appropriate consultation with other professionals with expertise in traumatic brain injury. The advice and recommendations of the Centers for Disease Control to support new research to develop better methods for identifying inmates with history of TBI and for determining how many incarcerated individuals are brain injury survivors needs to be heeded. Thank you for joining me this week, and I look forward to speaking with you again next week on another edition of the Brain Injury Insider.